Pregnancy can sometimes bring uncertainty or even be scary, but knowing that a team of doctors is standing by when you need them 24 hours a day with expertise in pregnancy can be a huge comfort.
And that is exactly what Carondelet offers, specially trained professionals standing by for any urgent matter that you might have. Dr. Beth Weiser, Director of Obstetrics and Gynecology, is joining us now with more. Good morning, Doctor. Great to have you here. I'm really glad that you have this offered for women in Southern Arizona, and I want to talk about what it means to you in just a second, but what makes the obstetrical emergency care so unique to patients?
So women are very busy, and women don't always have time to get into their primary obstetrician or their GYN during the day when those urgent or emergent matters happen. And so our emergency rooms are very crowded and they're very busy. So being able to come to a emergency center where there are specialists who are board certified OBGYNs who have ultrasound available can quickly reassure a woman that the pregnancy is fine and that their condition, if it does warrant further care, that can be provided for them on that basis.
Right, and why so important to focus on this population? I mean, rather than going online and trying to figure things out, I guess you see actual doctors, right? That's why you want to focus on
Absolutely. So our specialists are there. They're on site 24/7. The patients come in, they're able to see that physician, they're able to have whatever testing that they need, whatever testing that their baby might need, and it's quick, it's efficient, and we can, because women's health is becoming more and more complicated, and so we want to be able to give them the specialized care that they need.
And when you say quick, sometimes that is everything when it comes to babies.
Correct.
I mean, timing is everything, and if you go to an emergency room, you still are waiting in line, and then you may not even be able to see a specialist, right?
Correct. Depending on the gestational age of the pregnancy, early gestations can sometimes have unique complications associated with them. So for a woman to be able to be reassured that everything early on is okay with the pregnancy, and if it's not, to be able to have that care, it's paramount to them and makes them feel so much better.
Oh, absolutely.
So tell us a little more about the team itself.
Yeah, so Southern Arizona Laborers, we partnered with St. Joe's for the last 10 years. We provide all of the OBGYN emergency care for the patients that present to St. Joe's. But as of the 10th of November, we actually launched our Women's Health Emergency Center, and that has been live now for over 2 weeks. And so we have been able to, we're staffed with all board certified OBGYNs and covering the hospital for that.
Wonderful.
What has the response been from patients so far that you've heard?
It's been pretty amazing. They have been very happy about being able to get in and be seen, have their ultrasound right there on site, and be able to get back to home and then get in with their primary OB, the next day or the next week, depending on what the matter needs addressing.
And this is just a significant difference than other hospitals. I mean, talk through some of those differences. You've outlined some of them, but you don't get this everywhere.
No, this is the first. Women's Health Emergency Center is the first of the kind in the state of Arizona. There's only a handful of them across the country. This is very unique in that it is staffed not by emergency room physicians or mid-level providers. It's actually staffed by board certified OBGYNs. So being able to deliver this high level of speciality to women with OB and GYN concerns is definitely unique to Arizona and is pretty unique to the rest of the country.
I imagine that you've seen big things happen already, even though you just started in the middle of November. Tell us about some of the patients that you've seen so far.
So we've been able to have patients come over who are waiting. Our emergency room is very busy at St. Joe's, especially with our trauma center. And so we've been able to augment and help offload some of those patients from the main emergency room where we can have them come over. They've had some bleeding in the first trimester. We've been able to do their ultrasound, reassure them that they're fine, get them back and out the door, and get them back to work in their families. We've had women who have been able to come in who had maybe had surgery and they have a little bit of a concern. We've been able to reassure them that they're fine and they're healing appropriately. So women have been just very appreciative of the prompt care. They've been very reassured by the speciality of the care.
Just the peace of mind it brings, and not just the women themselves, but their partners too. I imagine it helps the whole family. Just sort of
everybody feels better.
Take a deep breath, right, and take it easy. And this really is sort of the future of medicine, and specifically caring for women and their babies, right, is more on demand when they need it.
Correct. And the other thing is that as medicine gets more and more complex and we have more resources available to offer people, being able to stay current in specific specialties of pregnancy and of GYN and specific specialties of medicine and deliver that care is very important.
Well, we're very proud of it now to have it here in Tucson.
Absolutely.
Doctor, thank you so much.
Thank you so
Thanks
much.
for being here.
Thanks for having us.
And if you'd like to learn more about the care provided at Carondelet St. Joseph's Hospital, visit carondelet.org or call 833-245-1663.